Hi, my name is Anderson. Today we will be discussing improvements, ideas for the clinic to increase our patients' health literacy and make sure that we're up to CLAS standards. CLAS stands for Culturally and Linguistically Appropriate Services. Basically, it means for ways to improve the quality of services provided to all individuals, which ultimately help reduce the health disparities and achieve health equality. The main issue we have with patient education is there are times when patient and the healthcare provider have issues with communication and understanding one another due to the language barrier. In this proposal, we'll go over ways to overcome the language barrier and help educate our patients. Having limited English proficiency in the United States can be a barrier to accessing healthcare services and understanding health information. This is unacceptable in our pursuit to promote health literacy. The first thing we will implement will be using multilingual forms in the front desk in commonly spoken languages in the area. The multilingual forms the patients will be using will be for patient registration as well as for inquiring why the patient's visiting today. They could be anything from just for a doctor's visit or for their yearly checkup, etc., etc. This will help facilitate the patient visit as well as help understand what brings them in today. We will assign the front office manager to implement these necessary changes. As for forms and the educational material, we will hire a design artist to create the necessary forms. After creation, we'll do a trial run to see if the material is accurate, and then the entire process should take no more than 2 months from fabrication of forms and education materials to confirmation of accuracy. The cost for the research and the creation of these materials should be no more than around $1,000 to $1,500. The second thing that will help our clinic with health literacy would be by diversifying our workforce. We will be able to have more opportunities for people to connect with other people from similar backgrounds. Companies with diverse teams have better understandings of the public's needs. Our proposed prioritizing diversity hires. Establish a hiring manager and specifically look to entice bilingual applicants. More so, we shall show that we value that they are bilingual by increasing their starting pay to help reflect that. For example, if we are looking to fill a front desk position that would usually start at $17 an hour, we would then offer her an extra $1 to $2 per hour after verifying that the applicant is indeed bilingual and will be proficient in the language that they're applying for. I believe this will be an ongoing process as we will continue to hire staff as the demand for increased staff increases. I believe this is imperative to the patient's education, as having a fluent speaker in their native language will help them feel at ease and be willing to ask questions to help with their treatment. The final thing that would help with the language barrier and increase health literacy would be to have a full-time medical interpreters on staff. Patients with limited English proficiencies are much more likely to have adverse effect from drug complications, poor understanding of diagnosis, low health literacy, and a greater risk for being misunderstood by their physicians. I propose to have a full-time medical interpreter on staff to help with patient needs, whether it would be to help the interaction between the healthcare provider and the patient or the assisting of filling out forms. They would be paid anywhere from $25 to $30 per hour. While we are searching for language medical interpreters, we should also keep in mind to look out for ones also proficient in American Sign Language, as they will also help with that situation where if a hearing impaired patient comes in, they will need interpretation as well. I believe this will take about 1 to 2 months to fill for this position, and then the hiring manager should also be in charge for this role. In conclusion, with the necessary updates to our clinic, I believe we'll be more culturally prepared. With the changes to the forms and educational materials, the hiring of a more culturally diverse workforce, and the hiring of a full-time medical interpreter to be present in our clinic, we should be able to break the language barrier. This will be a correct step in the right direction towards improving health literacy. This will also allow us to better meet CLAS standards.